Skin anatomy. In this chapter, we will talk a little bit about the skin structures and so on, but because there's so much scientific terms, so I'm not going to too much details in this lecture. This is something that you can read about if you want to know more about the skin structures and like details of it. So as we know that the skin is an organ that is made of tissues that work together as a single structure to perform critical functions. The skins will have multiple layers of cells and tissues. This is like a diagram of the skin structure of what it is. The skin consists of three main layers: the epidermis, which is on the top right here. This shed every 28 to 30 days. And then the next level under is the dermis. This is made of dense connected tissues that have blood vessels, hair follicles, sweat glands, and others. And beneath the dermis is the hypodermis. This is where it has loose connective and fatty tissues. Okay. Now we will talk about how this plays in permanent makeup in just a little bit. I'm going to kind of zoom through the structures of the skin because, again, this is something that you can read about. But basically, the thinnest part of the skin would be on the eyelids, and the thickest part of the skin is on the palms and at the soles. Okay, the epidermis itself contain this part right here can consist of 4 to 5 layers. And you can read about this. You can read about the dermis. You can also read about the hypodermis if you're interested. But this is the part where it's very important. So when it comes to PMU, where does the pigment lay on the skin? What is the correct depth? It's very hard for us to pinpoint the correct depth, right? So when you're working on the skin, if I'm telling you, hey, you gotta go like 1 millimeter into the skin, you're not gonna know like what is 1 millimeter into the skin. And if you're a new artist, it's even harder for you to gauge like how much into the skin your needle needs to go. And especially if it's moving like this, it's really hard for you to know like what is the actual number of the depth. So that's why in PMU, I don't think it's important to talk about like how deep, but it's rather a topic where you have to sort of like feel the needle yourself through experience, right? Like you have to know like what is the correct depth as you go into the skin. But in general, when we implant the pigment, into the epidermis, just touching the dermis right here. The reason is because if you only apply the pigment on the epidermis, guess what? After 28 days, that the top layer of the skin will shed, and along, you know, like the pigment that you have just implanted will fade as well. So that's why we want it to just touching the dermis, so that way it provides just a very soft shadow, soft pigment effect for your client. We don't want to implant deeper, because the deeper you go, the darker and more bluish and grayish tone it's going to be. Think of it like the deeper it sinks into the skin, what you see is no longer the true representation of that pigment anymore, but more like just a shadow of it. Think of it like like a deep pond, right? If you're dropping something as it's sinking deeper and deeper into the water, all you could see is just the shadow, right? So same thing with the pigment. That's why the hands-on training is so important. It's for me to be able to like show you what is the correct depth, that, you know, like each technique is supposed to be for each type of procedure, whether it's brow skin, or lip skin, or eyeliner skin, or the body tattoo, the tiny tattoo skin, because at each part, the depth and pressure is going to be different. Let's talk about skin types. Understanding different skin types will help you predict what the healed result is. It's not going to be 100% accurate prediction, but at least you would know like to adjust your technique a little bit based on the type of skin. Normal skin is basically really nice. They usually have smooth skin texture, very fine pores, no visible flakiness, blemishes, or whatnot. Often in younger people, or people who take care of their skin, their skin is very nice, and you already automatically know that your healed result will be really nice. The second one is dry, dehydrated skin. So when you see dry flakiness on the skin looks severely dehydrated, lacking moisture, you would know that the healed result could be quite patchy. It's not going to be even if your pressure is not even. So you want to be careful when working with this type of skin, because basically it doesn't have the oil production underneath the skin like oily skin. So the pigment that you lay underneath the skin doesn't like disperse, if that makes sense. Okay, so if your pressure is like accidentally like stronger at certain area or point, it's going to show right there. Sensitive skin. Sensitive skin is basically very thin, eggshell-like. They get red and irritated easily. With sensitive skin, you want to work light-handed, very controlled. If you're doing brows, then obviously that you want to choose finer needle, thinner needles to work with sensitive skin. When you're working on lips or eyeliner or tattoo, it doesn't really apply, because the skin type is only for like the facial. The third or the fourth type is combination skin. Combination skin is basically dry in certain area and oily in certain area. Now we're working with the brows, so obviously the T-zone is the oily area. So combination skin, it's kind of like the same as with oily skin. Your result could be blurry because of that oil production underneath the skin, like oily skin. The only difference is that with oily skin, you'll see the skin is a lot thicker, the pores are larger, it's more shiny, they're more prone to blackheads and stuff. The healed result could be okay. It can be blurry because the pigment that you lay underneath the skin will disperse pretty fast due to like that abundant oil production. But honestly, between working with oily skin and dry, dehydrated skin, I'd rather working with oily skin, because again, you know, it has that oil production. So I mean, if you make a mistake in like pressure wise, it doesn't show as much as on dry, dehydrated skin. And this is for brows. Mature skin is with aging. You'll notice that their skin is dry, but it's not like dehydrated. It's just dry with fine lines and wrinkles. With mature skin, when you're doing brows, the result will stay, it will stay. Like it, whatever you put down there, it'll stay. Like it doesn't really shed off that easy, because with aging, the skin is slower in collagen production. The skin cell turnover is slower too. So so the result that you implant, I'm sorry, so the pigment that you implant, the result will show however, you know, your pressure is. So I would say it's kind of like working on dry dehydrated skin, in terms of like whatever like pressure you place initially, it will heal like that. Okay, but with mature skin, if you do beautiful work, it will heal beautifully. The only thing is that they have wrinkles, so it's not very like picture aesthetic when it comes to like posting it and stuff. But on my older clients, I do like working on them, except for the ones that have mature skin and sun damaged. Okay, if it's sun damaged and mature, it's so hard to work on, because with sun damaged skin, your result will always be ashy. Like you can just tell when people like their skin is damaged by like the sun. Like you can tell if they have been a sun worshiper, you know, because you know that your result when it comes to brows on their skin, it's gonna be ashy no matter what, and it just doesn't heal nice. Okay, for lips, it's different. It doesn't really affect as much, although people who have sun damaged skin tend to have purplish pink lips, meaning like they have so much purple and like brown spots on their lips, because the lips lay under the sun too, so it can like be affected. Congested skin is the last one. Congested skin is kind of like dehydrated, but this, you'll see the skin looks kind of clogged up, almost like they're having a breakout, but it's not. You know, those are like congested skin. So with congested skin, again, it's kind of like working on oily skin. But the result is not as even as with oily skin. Congested skin, your result will be blurry, but it will be uneven at the same time. Like certain spot will have like less pigment, and then certain spot might have enough pigment. So that's with congested skin. Skin problems. So these are the problems on the skin. I have a list of you know, like some skin problems that, you know, if it happens on the actual area that you're working on, then you want to decline the client. These are basically kind of like the contraindications, but this is only if it's on the area that you're working on. Obviously, this is brows because this is for the face. On the body, you don't really see this. On eyeliner, not so much, and definitely not lips. So, for example, if you see the client has dermatitis on the brows, obviously, or the rashes, obviously you want to decline the service until their skin gets better. If they have psoriasis on the body, then obviously it'll be very hard to do, you know, like the tiny tattoo, because of constant, you know, like flakiness and stuff like that. If it's on the face, then again, it's hard to do brows because the skin will have like scaly kind of flakiness and stuff like that. So as long as it's not on the brows, then it's fine. Same thing with acne, right? If they have acne on the face but not on the eyebrows, then I would still work with them, but I do give them heads up that, you know, because of their breakout, congested skin, so the healed result might not be as expected, and that it might take them like a process to get to what they want. So maybe they have to come back for the second touch up. We don't know. We just have to kind of like go as the brows healed. So you can read more about these. When we're talking about undertone and Fitzpatrick scale in PMU, let's talk about like undertone, right? So melanin is also considered to be like undertone. So melanin has two primary forms. It's the eumelanin, where it shows as black and brown. Pheomelanin has like a red color. So with melanin, it affects mostly on lips, is when you need to do color corrections and a lot of like in-depth color theory that if you are enrolled in the lip blush modules for our lip blush training, we will deep dive into advanced color theory, where we will be correcting dark lips and so on, because dark lips have abundant amount of melanin. If you're working with brows or eyeliner, obviously it doesn't really affect. It only affects in terms of you choosing the pigment, but it doesn't really affect anything with the healed result, just because of the melanin level when it comes to brows or eyeliners. But for lips, melanin will affect the healed result. So how do you determine the undertone? There is the cool undertone, the warm, and the neutral. The cool will have like a pinkish tone, and the skin burns when they go suntan. Warm skin tone, it has like a yellowish tone, and they don't tan easily. Neutral is kind of like in between. Honestly, I never look at the veins. The reason why we talk about undertone in permanent makeup or Fitzpatrick scale in permanent makeup is because, again, this is just the foundational knowledge of PMU. But when it comes to choosing the right pigment, and this is one of the misconception, I think this is one of the biggest misconception when it comes to choosing the pigment. People tend to like choose the pigment based on the Fitzpatrick, based on the undertone and whatnot. But based on my experience, and I've been in this industry for 9 years now, the undertone isn't everything. Okay, later on we'll talk about how to choose pigment if you're enrolled into brow modules. We'll talk about how to pick the right pigment for brows, but the undertone isn't everything in terms of like determining color. But for the sake of giving you a broad knowledge of PMU, I'm just gonna have to go over the different types of undertones. But no, I don't look at the veins when I'm choosing color. Here is an example of what a light skin or like cool undertone would look like. You can see that her skin is very pale. It's kind of like you look at her and think of winter and summer and spring kind of thing. Okay, like this is like winter, right? Warm undertone, you see it's just like exude like a warm shade on the undertone, like because you can see like a little bit of the pinkish and things like that. Okay, and neutral is just in the middle. When it comes to ethnic skin, it's also divided into cool, warm, and neutral. So cooler tone, you will see it's a lot of melanin underneath the skin. So the more the melanin, the cooler the undertone is, right? Warm undertone, you can see that it's more like olive, whereas neutral is like this. The Fitzpatrick scale is a scale that explains there's 6 types of skin, right? When we're talking about Fitzpatrick 1, Fitz 2, Fitz 3, Fitz 4, right? We're referring to like the shade of the skin, right? Type 1 is like very light and pale. 2 is like white and fair. 3 is usually medium white. 4 is olive. 5 is light brown, and 6 is dark brown. Here is more example. So when it comes to like white Caucasian, they're usually between type 1, 2, and 3. And then Asian is usually type 3, 4. I would say 3 and 4, between 3 and 4. And then Black or African American would be 5 to 6. Here's more example. I have this all in like the booklet. You can either print it out or you can download it, so that way you have like a few examples of what each Fitzpatrick might look like, because I know sometimes with like the description fair to pale or fair to beige, it's kind of hard, right? But if you look at examples of like, this is type 1, 2, 3, 4, 5, 6, then you kind of like instantly remember, right? Let's talk about contraindications. Contraindications are basically like a no to perform, right? So some of the contraindications that I list as temporary, meaning that they can't do it right now, but they can do it at a later time when this is all over. And pretty much it's the same contraindications when it comes to brows, lips, eyeliner. Same thing with tiny tattoo, just really depends on actually tiny tattoo, since it's on the body, it's more lenient. For example, like if the client is using retin A on their face, obviously it has nothing to do with getting body tattoo, so they can still get body tattoo, right? But if they're using it for on the face and they're getting brows, then it's gonna affect, because retin A is very strong. It like once when you apply, let's say on the forehead, it does travel down a little bit into the brow area, right? So these are like temporary if the client is pregnant. This is the most controversies. I know some artists, they don't want to take clients who are pregnant at all. It doesn't matter how far, how early the pregnancy is, they're not gonna take you if you're pregnant. For me, I actually do take clients who are pregnant if they really insist. Obviously, my first recommendation to the client would be to wait. But if they really can't wait and they want to get their brows done, then I only perform the brows if the client is under 3 months in their pregnancy. If they're breastfeeding, again, it really depends. Yeah, but I do let them know that the reason why we don't want to perform on women who are pregnant or breastfeeding is, let's say if they're not taking care of their eyebrows good and or lips or eyeliner, then what if there's infections and they're gonna need to take antibiotics, and if they're pregnant or breastfeeding, they can't take medication, right? So that's one thing that I wanted to, always wanted to make sure the client understand if they still choose to proceed. Accutane is a type of acne medication, a topical medication, and it's really strong. It thins down the skin, so obviously they need to wait until they're off of that. These are the contraindications that maybe I can perform if I have doctors know, is if the client is like have uncontrolled diabetes. If they just have normal diabetes, it's like usually it's controlled, then it's still okay. But if it's uncontrolled, then obviously you can't perform. And most of the time the clients would like tell you anyways. If they don't tell you, and they have, they fill out the consent form and things like that. So yeah. Let's see. Psoriasis, again, with the psoriasis, if it's not on the treating area, then it might be okay. But again, if you're worried, anytime when you're worried, you don't know if you should take this client due to like one of the said contraindications, always require a doctor's note. Alopecia is not contraindication. People that have alopecia just lose their hair because of their immune system mistakenly attacks the hair follicles. Alopecia kind of just randomly come, and and it just make either the eyelashes, it can attack pretty random. Like some people have alopecia on their brows and hair, but not on their lashes. Some people have alopecia on like all like hair, brows, lashes. So it just really random, and it really depends. But alopecia clients, their skin tends to be thinner, and it's just more eggshell. So working on alopecia clients, you want to make sure that you lighten your pressure. That's number one. And this is for brows, okay? Number two, if you're new, I don't recommend working on alopecia, because every single mistake that you make is going to show, because there isn't hair. If you're working on normal clients, then at least they have some brow hair that can kind of just camouflage the mistake if you accidentally go like the wrong stroke, or like a little bit darker at certain spot. But with alopecia, every mistake it's gonna be there. Like whatever you put, it's gonna be there. Alopecia tends to heal pretty good as well, just because their skin texture is actually pretty smooth. Albinism is not contraindication. Albinism is like a disorder where where certain like skin, hair, and eyes discolored. Again, it's because the melanocytes underneath the skin unable to produce like the melanin, so that's why they lose pigment everywhere. People with albinism tend to not getting permanent makeup as much. I don't know why. Maybe because they're so fair that they're just really careful on like anything that could create like harsh look to their face. But people with albinism, even with like, let's say their eyelashes, right? If they're getting a lash tint, the tint tends to be stripped off pretty fast too. Like it doesn't hold. Their hair structures, it's so smooth that like if they dye their hair, the color just kind of like fade off really fast. So anything that goes on the hairs just seems to fade pretty fast. Vitiligo is not a contraindication. This is a condition where the melanocytes lacks the ability to produce melanin under certain, like at certain spots. So that's why it leads to loss in color in patches. People with vitiligo can still get permanent makeup.